Great. So welcome back, everyone. And I'm very happy to introduce our next session, where we're bringing together an awesome mix of real estate professionals working across both corporate real estate and also the hospital sector. I'm going to very briefly introduce who we have here with us before we dive into the discussion panel. So I'm very pleased to be joined by Gabrielle DeVoe. She is head of global real estate and facilities at Riskified. And I've spoken to her many a time, and she always brings some very interesting points of view. I'm also pleased to be joined by David Sullivan. He is Chief Infrastructure and Support Services Officer at NYC Health and Hospitals. So welcome, David. And I'm also pleased to be joined by Tony Vargas, who is Global Head of Workplace at Sprinkler. So welcome, everyone, and thanks very much for joining. The topic of this panel is really to partly hear from you guys around where you are with your return to work program, and also think about some practical and cost-effective solutions for making workplaces safer during this time. But to kick off the discussion, I thought it could be good to get a bit of an update and roundup from everyone around where they are with their return to workplace program. So if we could start with you, Gabrielle, and hear a bit about where you guys are with everything.
Hi, good morning. As soon as phase 2 entered in New York City, which is where we're located, we opened up our doors. We wanted it to be an opportunity for people who either didn't have an opportunity to work from home, either because they have kids or because they just didn't have a setup to do so, or just wanted to see people. So we've been open since early July.
Cool. Okay, very good. And Tony, what's the situation for you guys?
We are on the other spectrum of Gabby. We have decided that we did not want to be first adopters. We wanted to make sure that everybody had the opportunity to work from home and work safely from where they were before we came into offices to offer that. Since we have opened our doors in APAC, Asia Pacific is doing much better than the rest of the world in terms of controlling the virus. So we've opened our doors there and just surveyed our population in Europe, in EMEA, to understand what their needs are and then plan for that.
Interesting. And Tony, I guess with lots of people working from home, has that resulted in you and your role getting involved in home-based stuff, whether it's shipping over new equipment to your staff, making sure people have got the right work set up at home? Have you got stuck into any of that?
Yeah. So I say, to me, the future is hybrid, and I kind of read that early on.
Yeah.
So I started developing ways that I could adjust my workplace strategy that involves the environment, the experience, the hospitality, the community. That how could we extend that into people's homes? And when we're talking about setting up the environment, obviously we couldn't buy furniture for everybody for their home setups, but we did find resources to help them either make the best of what they had, supplement with a couple of things that were dire needs. We couldn't afford to just kind of give money away like some of the big tech companies, but we did make sure that people had comfortable setups to be able to be productive and efficient and be focused and be creative.
Okay, very good. And now I'd like to come to you, David. I guess working in an entirely different sector that has been forced to remain open and probably perform higher than usual. It would be really interesting to hear from you what projects you've really been working on over the past 6 months, and a bit more about your experience.
Sure. Thank you for having me. Prior to being with New York City Health and Hospitals during the height of the pandemic, I was actually with New York Presbyterian Hospital. So we pretty much, as you know, hospitals never shut down. We got even more busier than we ever have. Some of the project we worked on was transition of cafeterias to ICUs. We had a cafeteria that we actually turned into an 18-bed ICU. So we had to be very creative and think outside the box to accommodate all that we thought we were going to take in. So it's been challenging, but it's been very rewarding to see how everyone pulls together and gets it done.
Okay, very good. Well, that was a great kind of update around where everyone is. I'd like to dig into that a bit more and have a bit of a discussion around any quick win or low cost initiatives people have been implementing, whether it's kind of within offices, hospitals, at the home. And actually, Gabrielle, we've had a bit of a discussion about this kind of what are the quick win initiatives that everyone should be thinking about. And they're not always high tech initiatives. In fact, some of the things that we were discussing were quite basic, but at the same time effective. It'd be good to kind of hear about some of the more simple measures that you've been exploring, implementing, or thinking about.
Well, it's funny because Tony and I are on opposite ends of the spectrum, because we kind of strive, absolutely. We all know now that we have the capability to work remotely. But as I said before, not everybody has that ability to do so for one reason or another. And just honestly, we believe that there's an unquantifiable value to being together. There's just certain things that those casual collisions will not happen remotely. And it's something as simple as just opening the windows and getting some fresh air will help mitigate some of the concerns that we have with the filtration systems and being indoors for more than an hour at a time. And simple things like that really revolve around probably the optics of it all. I think that's what's going to make people feel incredibly better and more comfortable. So if it's just having masks available, we gave everybody safe keys so that their touch points are alleviated, and having Lysol wipes and a porter that walks around. So having those visuals, I think, has been a very easy, quick win, as you said.
Great. Yeah, very good. And actually, I've seen in a lot of the government guidance around reopening the workplace, open the windows seems to be a common one you see across lots of geographies. So that's very interesting. And then, David, it'd be interesting to kind of hear from you in the world of healthcare. I guess infection control has always been very much on the agenda, top of the agenda for decades. Have you guys been implementing any new initiatives?
Sure, we've definitely stepped up our terminal cleaning. Anytime our centers are closed, we do a terminal cleaning every evening now. Usually we've done that once a week. Now with COVID, obviously we've stepped up to every day. We also do a point of entry screening now through app. So before any patient or staff member comes in, you actually have to go on your app. You answer simple questions and you'll either get a green or a red pass. And the green pass means it's, you have no symptoms and you're safe to move forward. For the staff, for the patients, if it's red, they're triaged, kind of in a vestibule outside of the location so that we can see what's going on and prevent the spread.
Very interesting. And yeah, I'm curious, do you think that type of technology will stick around and be with us for the long term? I mean, it sounds as though in a hospital setting, it's kind of always useful to do a bit of a health check on people before they come into the building. And any thoughts on that around whether that's here to stay?
Sure, I definitely think after this pandemic, I think people will get more used to it, and I don't see it going away. I think it's a great thing for hospitals. It'll keep the infectious disease rates down. I think, sometimes there are positives. I believe you always have to look at the positives of things. And I think this is one of the positives that introduced us to new technology that perhaps people wouldn't be so comfortable using. And now we have to, so they have no choice. But I definitely think it will help the hospitals in the long term to keep the infection rates down and readmittance for patients.
Very good. And I guess, Tony, with most of your staff working from home, kind of one theme that we're hearing a lot more about now is kind of mental well-being. The idea lots of people are kind of maybe feeling a bit more disconnected than usual. You don't have that person-to-person employee contact. Is that an area you guys have been tackling? I mean, I've heard there's all sorts of programs, anything from a a manager checking in with their employees more regularly through to more sophisticated well-being mobile apps. Just be interested to hear what you guys are doing around that theme of kind of well-being for the remote worker.
Absolutely. So wellness and culture are the two things that we leaned into really hard when we decided we weren't going to be early adopters of going back to offices. And in terms of wellness, we have two wellness specialists in-house. One of them leads 3 meditation sessions throughout the day so that it can cover all our time zones. So there's 15-minute wellness breaks that are available throughout the day. We also offer a daily physical workout that's led, through virtually. So also in-house physical wellness expert that leads a workout, all to give people options that are within our offerings for wellness. In terms of benefits, we have Headspace, Audible, a lot of things that people can do on their own. So it's asynchronous wellness activities that people can do, so they can do it when they need it. So we've leaned in really, really hard into wellness programs to give people the resources that they need for a mental well-being, well-being for the soul, well-being for the mind. So there's LinkedIn Learning and Audible, so people can get the resources that they need, not just for business cases, but also self-care, self-help, et cetera. So we're always looking at engagement activities that we can do that are wellness based, just to tackle particularly the challenges that come from working from home. We also, we implemented daily heartbeat calls. So every team, besides having their business calls, has 15-minute calls just to check in with each other, just to say, this is not when we talk about when's the project due, where's the spreadsheet, you didn't answer my email. These are 15 minutes that every team can get together and say, guys, today was hard. My husband's voice on these video calls. And by the way, that's my husband saying my voice on these video calls. But a chance for people to connect outside of the business. Weekly team meetings. So we built a structure for that connection. And Gabby said it, there's no replacing that serendipitous, that passing by, there's no replacing, but knowing that we weren't going to have that because we weren't going to be in offices, we did build programs that could hold that space. I wouldn't say replace them. We're never going to replace them, but programs that could hold that space for those interactions. I recommend to people, and use my team of workplace specialists. I recommend that they go into different teams meetings, of course, get invitations for them, but just to have a little bit of that cross collaboration. One other thing that we did for culture, just to have a center of culture, is a daily talk show. And Gabby knows about this. I happen to co-host it, for Sprinkler, but we did a daily talk show. So it's an update so that people have one place where they can go to get some of the information that's not just business-wise, but fun related. We feature Sprinklerites every single day. We interview a different Sprinklerite every day about their passions, about the things that they're working on, about any initiative that they have going on for work with a call to action. So we've built all these things to provide an opportunity for culture and well-being while we are geographically dispersed, which, by the way, then we will adjust to when we go to a hybrid setting, because we've learned the things that work and we will adjust them to a hybrid setting. And that way, everybody, whether you're in the office or at home, can participate.
Just to add on to that, I mean, the thing that is so nice about that, because we're kind of teetering on both ends of the spectrum, as far as we have a fair number of people who are choosing to stay remote until this is in our rearview mirror, and there are a lot of people who are coming in. So we are trying to cater to both. And the thing is that through remote, we really have sort of personalized a lot, right? We get to know about people's kids and what their interests are. And that's been a really beautiful thing. Like, in such a disaster, to kind of like cross that line and to go onto the humanized side of all of us has been very nice. And to kind of implement that then back into the workplace, I think has been a tremendous value.
Yeah, I like that. And it's so we should take these kind of new learnings and best practices and try to keep them with us. So with those interesting points, I'd actually like to launch a poll for the audience. This should appear on your screen. And the question is around technology. So what technology do you plan to deploy across your building over the next 12 months? And as we wait for those results from the audience to filter through, and we'll have a quick look into them in a few moments, I'd actually like to talk a little bit more about technology. I've been hearing within some of my conversations that there's new interest in trying to create a touchless experience within buildings. And that can be from very simple initiatives to adding kind of new signs onto counters and doors saying, please avoid touching, right through to some more sophisticated touchless security and access control systems. So I think touchless, David, was a theme that seemed to resonate with some of the work that you were doing within your hospital. I'd just be interested to kind of hear a bit more about how you're applying the theme of touchless within your work.
Sure. So I know at Presbyterian, on the newer sites, they were actually building in security scanners inside the walls so that when the patients or the family members come through, they'd be scanned and wouldn't have to go through the turnstile that's already built into the infrastructure. You know, that's great for a newer building, but for most of New York City hospitals, they're older, and we really can't do that. So I think incorporating technology and also trying to understand, you know, we're working with an older building, a lot of times 80 years old. We have done some of that. We are looking to obviously do more. I always say, I think, you know, again, you've got to look at the positives. And I think for hospitals, at least, they were looking at what the aesthetics were, what the patient's experience with aesthetics, what it looks like, the lights. I think this now has refocused on, you know, the infrastructure counts as well. So the HVAC counts, what's behind the wall counts. And, you know, it's nice to see resources now being reallocated to those things that have been for many years kind of pushed to the wayside to see, you know, to kind of accommodate more of what you can actually see and touch. But the small things we're looking at are converting bathrooms to touchless faucets. We're trying to understand, you know, and get our hands around how we can convert doors to being touchless, whether through motion or through, you know, passive doors where we put an inside kind of door and we make it like a little bit of a maze to get in. So you don't actually have to touch anything, you just walk through. So those are the small steps we're taking. Again, it's very challenging in New York City hospital healthcare. The buildings are very old and we kind of have to work with that.
Yes, that's right. And actually very similar, I guess, in London where I'm based, there's so much old building stock around, apart from your very high-end flashy buildings in the financial district. So very interesting. And I'm just going to kind of bring up the theme of touchless with Gabrielle, because I think that was something you were thinking about within your own workplace reopening program, about trying to reduce touch points down. It'd be good to hear a bit more about that. What were you implementing? How are you approaching that theme?
Like I said, the quick win and a lot less expensive was to implement the safe key, which is, you know, anything from acrylic to metal. And like I said, you can use it to open drawers and doors and elevators. As far as the buttons, the only thing we realized, it doesn't do 4 things. It doesn't pour the milk for you, and that's something everybody touches, as well as the espresso machine. So that's when we ended up putting a porter in the kitchen. So it's sort of like a barista, if you will, and it's nice, and it's someone else to talk to. And you know, to David's point, you know, this is a lot of money to allocate for things for people not to see. And right now, people need the visuals. I think people need that, you know, call it theater, call it optics, whatever it is, to feel a little bit more comfortable. And so right now, we will be putting money into things that people can actually see, not behind the wall. And unfortunately, that's, you know, the thing, other than putting in filters. And we take a page from what the hospitals do. We let them be the early adapters. And then we say, well, that works. Okay, then it warrants spending that kind of money. But out of the gate, it's not something that we're, you know, to Tony's point, we're probably going to do it for cultural components and just to try to keep those, you know, everybody sort of happy and feeling good.
I love that, and I agree 100% about the optics. I think in every survey that we've done with people, what they say will make them feel safer is more cleaning, or more less touching of things. And if they see that it's happening, so if you do all your cleaning throughout the day instead of at night as we used to do it before, so people didn't see it, it'll make them feel safer because they're seeing that it's being done. And Gab, I love the idea of adding a porter. The cultural experience is fantastic.
Yeah, no, it's actually an interesting point with cleaning, because before COVID, we always wanted that kind of out of sight and out of mind. But now it's almost like workplaces are trying to orchestrate cleaning programs so they're as visible as possible. So yeah, very interesting. I just wanted to dig into what we heard from our audience. So as a reminder, the question was around what workplace technology will you be implementing over the next 12 months? And with the question, there are about 10 response options. I'll just read out the top 4 options. So 26% of people said they're implementing space booking apps. 22% of people said visitor management systems. 15% of people said contactless technology. And then 15% of people said workplace contact tracing apps. So those are the kind of hot 4 technologies. Interested, Gabrielle, for you, any of these kind of technologies on your roadmap?
I realize I didn't answer your question after all of that, but yes, my company already subscribed to the kind of find a desk as you come in, and the clean desk policy at that, as opposed to other companies that kind of owned their real estate. I came into this company, and I started in COVID. I started at the end of May with this company. So it's really interesting to like, oh, okay, well, that's something I don't have to, sort of fix. But yeah, there is, and there's certain companies and software companies that will do 2 of the things that were mentioned, that will allow someone to reserve a desk as well as do a health screening. So that's something we've implemented already. So it kind of kills 2 birds with 1 stone.
All right. Okay, very interesting. And then Tony, I don't know whether you're kind of at the point of thinking about what new technology needs to go into the office. Any of those items that I mentioned there on your roadmap, or potentially you're already using them?
Absolutely, and I'm in talks with a couple of companies, and my challenge to them is I want one solution that does all 4. Yeah. One place where I can manage my visitors, where I can reserve, where people can say I'm coming into the office today and reserve a desk on it, or I have a guest that's coming, so that they engage with just one platform. We all have platform fatigue, right? You have to go on one place for instant messaging, another place for email, another place for this and that. So I really, it's about the employee experience, that they can adopt one new platform where they can manage everything. Reserve a space that day. My team can manage capacity. We know they answer the health screening. So at the same time, we can do some contact tracing. They can reserve a desk if they need it. So I think that any platform that puts all of that into one cohesive, seamless to use product is going to be the winner in this.
Yeah,
and Tony, right. To your point, it's the ease, right? You want it to serve a purpose to make it easy and user friendly, but we don't use technology, at least I can speak for my company, we don't use technology to engage with employees. And that's so much of a thing we tried to capture culturally, to like, you use technology to serve a specific purpose, but not to engage, right? I mean, just think about your daily life and how you use your apps. And so we kind of always trying to fix 2 things with what we do. So just something to keep in mind, that when you're implementing technology, is it engaging with employees in any way? Or is it just making it something to make life a little bit easier?
Very good. And then keen to get your view as well, David. I mean, are there kind of any new technology projects on the horizon, anything new, entirely different that you're considering doing? I mean, we've been hearing about some hospitals looking into lighting, disinfectant technology, some hospitals looking into cleaning robots. Anything like that on your roadmap?
Actually, yes, indeed. We are actually sending out RFP to vendors. Part of that RFP does include a robotic UV ultraviolet light cleaning. We're looking into, what the cost benefit is to that. How many do we need? The ideal world would be to leave one little robot in everyone's room so they can just continuously clean with ultraviolet rays in the bathroom, anywhere there's high touch points. So we definitely are looking into that. It's just a matter of resources, and then we'll go from there. But there are small, easier things that we are implementing, like the contact tracing. That includes when you sign on to the app, anytime you enter a different building, every employee has to enter which building they're entering. So each building needs its own specific entrance point. And this way, we know where all the staff has been, and we know we can trace them a lot easier. So there's things we're doing now, and there are things we're looking into in the future. But again, as everyone said, it's a matter of resources.
Great, very good. Well, I'm just looking at time, and it looks as though we have got to the end of our allotted session. I have to say that raced by, really interesting insight. So I wanted to give a big thank you and virtual round of applause to Gabrielle, Tony, and David. Thank you so much for taking some time out of your busy days to speak to us.
Thank you.
Thank you very much. So we're just going to wrap up there, and I'm going to go off and find the next speakers for today, and hand over to my colleague Ibrahim Yates, who will be hosting the rest of the session.